patients. Well, Niall Dickson is the Chief Executive of the NHS Confederation.
Well, I think we've certainly got the first step. This is the government recognising that it's fine to hope for the best, but you've really got to plan for the worst. And I'm pleased to say I think there has been some considerable planning, both on the pharmaceutical side and on the NHS side, if I can put it that way, so that things are done at national level in the way that they should be. But I think we should also see this only as a first step, and that further details will have to be provided both for industry and for the health service to make sure that whatever happens, if there is a cliff edge when we leave the EU, that patients continue not to be collateral damage, but to get the medicines and the treatment that they need. I think it's absolutely right that the government is saying that either individual patients or hospitals shouldn't start stockpiling. Leave the stockpiling thing to national level and to the companies that are responsible for those products, and that will be done in an orderly way so that there are the necessary drugs, the treatments and everything else that's necessary. But it is worth remembering that the health service, a bit like every other industry now, works on a kind of just-in-time basis. These are highly complex organisations. If you take a hospital, for example, the operation that is carried out today, some of the materials for that operation will have been delivered the day before, and there will be a complex supply chain before that product actually reached the hospital, and some of that may well have involved crossing European borders. So we've become very interdependent. This is true of the EU as well as the UK, on each other over the last 40 years or so. And obviously, unless people are sensible and unless we plan properly, then of course that could have a really damaging effect. I mean, I have to say, especially after today, I'm more optimistic. I think the government, and we have been working with the government, our members have, in order to try and develop this guidance. I think we are on the road now to making sure that even if we do have a kind of bumpy ride over that period, we should have the right plans in place.
That's Niall Dickson, who's the Chief Executive of the NHS Confederation.